Hello, and welcome to another episode of Discover with Spinati. Today we're discovering bone disease. When I talked to a person that I know very dearly, and I said to them, and I said that you have bone disease, they looked at me with suspicion. They said, "What do you mean I have bone disease?" I said, "You have periodontitis, man." And then he said, "How do I have periodontitis?" I said, "You've lost bone." So he looked at it as a holistic thing, and he said, "How the heck did I lose bone?" Because he imagined it as, when you lose bone from your feet or you lose bone from your hands. But I'm talking about losing bone from your jaw. And it's true, like you're actually losing bone. And this condition is called periodontitis. Periodontitis is a disease that I consider to be bone disease. I mean, it is bone disease because it allows you or gets you to lose teeth fast without you even knowing. Next thing you know, you're going to wake up and your teeth are going to start becoming very loose, and then you're not going to have any teeth anymore. I mean, it's an exaggeration, but this is bone disease. Now, how can you prevent it, and why should you even care? Bone disease, no one really talks about bone disease. No one really talks about periodontitis. It's not the famous word of the day, right? Many people talk about teeth whitening. We talk about cavities. We talk about brushing your teeth. We talk about flossing. We talk about all these things with regards to your teeth, but really the quintessential element inside your mouth is the gums, the pink tissue, okay, the tissue that is surrounding the lovely teeth. And I mean, I want to show you some images, and I know it's really early in the morning and you probably don't want to see this stuff. So probably I shouldn't, but I probably will. But I'm going to give you a heads up before I do. Before I do that, though, I want to let you know that periodontitis is a disease that once you get it, you cannot go back from it. Okay, it's like diabetes. Once you get diabetes, you can't go back from it. Periodontitis is the exact same way. And the reason is, and this is like literally every single patient that has periodontitis and they get diagnosed with periodontitis, and we tell them that now you've lost bone and now you have to, if you want to prevent having more bone loss, the only solution is for you to come in on a more frequent basis, either 3 monthly or 6 monthly for dental cleanings. Then they say, okay, well, like, how can I get bone back? Because now they're like, okay, well, I got to the stage. No one really told me about this before. Well, they were told before, it just wasn't emphasized as much. And now they want to get bone back. And it's like, okay, well, you can't really get bone back, right? Like you can't grow bone back. So once you lose the bone, then that's it. It's done. Okay, so please pay attention because losing bone obviously is not fun. And losing bone means that now you have to really be careful so that you don't lose more bone. Because as soon as you lose bone, it becomes incredibly easy for your body to cause the bacteria to aggregate around those areas where you have bone loss, because the bone loss happens around the teeth. And then that causes you to actually have further bone loss or more severe periodontitis. So, what's the solution? The solution is easy. And it's actually quite easy because periodontitis or bone disease, you can prevent it really easily. But on the opposite side, you can also get it very easily. And so the best way for you to prevent it is to do two things and two things only. The first thing is to make sure you go to the dentist every 6 months. I know that there's, people are saying, why should I go every 6 months? My insurance doesn't cover it and all this stuff. You can do whatever you want. It's fine. Okay. It's up to you. It's your health. But from my experience, I have now almost 10 years of dental as a dentist, being a dentist, and I've seen it countless of times. People who come in every 6 months have the best health. It's like a guarantee, basically. People who come in every 6 months, they have the best health. People who don't come in every 6 months, it's a big hit and miss. People who miss their dental appointments, they're the ones that have the worst dental health. And so that's the first thing you should do is make sure you go into the dentist every 6 months for your cleaning and your checkup. That's number one. Number two is every single day, make sure you're brushing and flossing. That's it. That's like the magical solution for you to prevent having bone disease. Okay. So those are the two things that you should prevent. How do you get bone disease? Well, I mean, you don't do those two things. It's really that easy. And I hope I convinced you as to why bone disease is really important, because without bone, without your gums, you won't have teeth. I've had patients who come in to my clinic and they have really, their teeth are okay. They're not the best, but their teeth are okay. but their gums are all over the place, right? They've lost a lot of bone. Some teeth are very loose at this point. They didn't know that, right? Some teeth have pus around it. I'm not joking. This is like for real, okay? And now they have to be on a maintenance program. Some of them really improve. People who actually become diligent and listen to the instructions, listen to the recommendations specifically for them, they actually improve. Their teeth really become solid, right? Even if they don't have that much bone, but because we're helping them and they're helping themselves, right? With the coaching that we give them, we're helping them and they're helping themselves together as a team, synergistically. We are helping each other and helping them maintain their teeth in their bones so that they don't lose their teeth. That's the whole point of the game. Now, lastly, before I go, I do want to let you know, and hopefully I can convince you even further with this, that if you say to yourself, okay, so what if I lose a tooth? It doesn't matter. I'll just put an implant in. Well, I'll just put a bridge, right? I lost a tooth. I'm going to put a bridge. Well, let me give it really clearly to you, all right? Very, very clearly to you. If you have bone disease, you can't put an implant in. I know, shocking, but you can't, because if you put an implant in when you have bone disease, the implant's going to fail. So now you spent all this money on the implant, and now you're going to lose the implant. You're going to be really mad, and your dentist is not going to be happy either, because it's hard. It's not easy to put in an implant. So you can't have any implants. You can't have any crowns. You can't have veneers. You can't even do teeth whitening. Because if you have bone disease, things will just get worse dramatically if you do any of these kind of procedures. So that's why it's really important for you to make this a component of your daily ritual or your yearly ritual, okay, or your health ritual, whatever you want to call it. Just make sure it's part of your ritual for you to maintain the health of your gums and your bones so that you can keep your teeth in your mouth for the rest of your life. Have yourself a wonderful Wednesday. Happy hump day. And as always, keep smiling.